Hottie love in the house, dropping knowledge and facts, uncovering the truth, no need for acting lax. She ain't afraid to speak her mind, breaking through the lies, rising up with love, taking us to new highs. We're living in a world full of secrets and deceit, but Hottie's here to expose, bringing truth to the beast. She's got a message, spreading it far and wide, from addiction to hope she's on the other side. Ooh, yeah.
Record it too, but I don't know how.
Hello and welcome back to another episode of Deplorable Nation. And today I have the beautiful, lovely bestie, Miss Heidi, coming back to have a chit chat on a very, very interesting medical topic that I have never in all my years on this earth heard of until she brought it to my attention. I've never known anybody diagnosed with this, but this is the most trippy thing I think I have ever looked into.
Trippy is the right word. I'm like, I didn't know either. I wanted to do she said, let's do a medical one because me and Janet can do the medical ones. And I was like, yeah. And then I started looking at what is the weirdest medical thing? And this came up. I was like, okay.
I wondered how you found it. I'm like, did you just think this up? And I'm like, oh my God, it's really a real thing.
Did I make it up? I know I'm at home creating new diseases. No, don't come at me, NSA or whoever, 3-letter H. I'm not.
Concocting it was things in your basement.
Yeah. Yeah. I was like, what in the hell is this? I thought it was fake too. And then, when they do talk about it, they abbreviate it. Mm-hmm. And so that AIWS. And I think I have heard that before clinically, but I didn't know what it was.
I have not. And I have been on this planet a very long time. And I've worked with a lot of different specialties, and I've never heard of this, never seen a patient diagnosed with this, but it's very interesting.
Very.
So today we're going to get into Alice in Wonderland syndrome.
And it's not a fake.
Yeah. I'm gonna steal from Paranoia Radio. Hashtag look it up.
Yeah, look it up. We love him too. Shout out Troubles Garcia. We love you.
So let's start with the basics. What in the world is this?
So strange. So Todd syndrome, it's also known as Todd syndrome or Alice in Wonderland syndrome because they think that the guy that wrote Alice in Wonderland might have had it. And so that's kind of why they coined it as that. But the first guy to be diagnosed real, I guess, with it was in 1952. And that was a case of Lippmann, and Dr. Todd treated him in 1955, Dr. John Todd. So it's also interchangeable with that one. But it is literally a brain condition that disrupts how you perceive your own body and the world around you. So it's not as rare as people might think. It actually occurs up to 30% of teenagers at some point for a short period, but they miss it, as me and Janet were just talking about, constantly,
right? Because
it can be misdiagnosed really easy.
Well, and one of the things that we were talking about before the show, because anytime somebody comes to you or comes to a doctor's office and presents with some of the symptoms that come along with this, where they feel like maybe their hand is larger than the rest of their body, or their nose is so small you can barely see it, or whatever. And it's like this visual or depth perception that people have of their body. And the very first thing that a medical provider is going to do is dismiss you as a cuckoo bird.
Or tell you it's body dysmorphia and it's normal because you're a teenager.
They're not going to take you seriously.
Yeah, it's actually in your brain because they say it may originate in the parietal and occipital parts of the brain, because the occipital is vision, and then the other one it is your perception with the parietal, and also it can affect in the frontal lobe because that's where it originates, and it's related to epilepsy, which I found fascinating because I'm like, that makes sense, with what we'll get into with the kind of symptoms and things. And I thought that's wild. And maybe some cases of small epilepsy where they just have certain little things, I wonder if they're actually misdiagnosed.
You
Where they
know,
have that.
and you know me, I'm always thinking like on the other side of things, and like what, because they can't tell you for certain what causes this. It's another
Right.
one of those quote unknown origins, but we think it could be related to X, Y, and Z. So, me being, you know, medically minded, analytically minded as far as thinking about things and what could possibly be going on. Um, the neurons and the synapses in our brain are a very interesting thing, and they run on, you know, like electrical current. They're responsible for releasing different chemicals and things like that to go along the pathways. And so when electrical activity or stimuli comes in to a neuron, it comes into a branching unit called a dendrite, which looks like little fingers or whatever. And then it goes into the cell, and then it comes out the other end, which is called an axon. And it's sent along the nerve pathway. And it either, if it's electrical based, then that makes a smooth transition. However, if it's something that's chemically based, that's very complex, and it causes misfiring of the synapses, and can also cause problems with the 12 cranial nerves that we have
Mhm.
that literally affect every one of the senses that are involved in this. So
Yes.
that was my first thought along the
Yep.
thing. And there are lots of things that affect not only the neurons and the synapses in your brain, but also the cranial nerves that we start getting from birth,
Yeah. Yep.
like vaccinations with heavy
Yeah.
metals and
And
stuff.
poison food and water and things like that. You know,
Yes,
uh, additives. We won't say poison. We'll say
it
additives.
is toxins.
Yeah.
Mhm.
And I mean, let alone our exposure to people will laugh and poo-poo it, you know, but for like 5G, even Wi-Fi, like all
Mhm.
these things affect us because if you go somewhere else, like camping or something, and you come back and you're not around that for a while, you definitely can tell. It's
Right.
weird.
Right,
Yeah.
because you've been removed from the electrical current and all of that stuff, and then when you come back, you have that, like, oversensitization toward,
Yes. Yeah.
you know, electrical
Everything.
stuff,
Yeah.
so
So weird situation with this one too, because it has so many things that it can affect that I think that's part of this misdiagnosis, let alone that they only have stabs in the dark as far as what they run um,
Mhm.
for the testing. If you get them to run it and they don't just say you have body dysmorphia,
Exactly.
you know.
You are crazy, and we need to commit you because you're imagining things. It's all in
Yeah,
your head, because that's one of doctors' favorite things to say to
for
patients.
sure.
Always tell
Absolutely.
you that you're
Instead of
nuts.
looking further, right? Because some of us are train wrecked medically. Like every time they add a new
Right.
weird thing to my stuff, I'm like, just leave it alone. They don't care anyways. Like if you add it to it or don't add it to it, they even say like with Ehlers-Danlos, like, oh, that it took forever for me to get diagnosed with that. And mine's really impressive.
Mhm.
And yet they sit there and say, oh, it's irrelevant. No, it isn't. It's
Yeah, no,
affecting
it's not,
everything.
because
Yeah.
your how your body functions is very different with Ehlers-Danlos than a normal person.
Me and
Not
E
that you aren't
me and
normal. I
me
didn't
and
mean
Ellie
that.
are alien babies. That's what it is. That's I don't know. But for the first time ever, I was glad I had it because I would have had a broken ankle apparently if not.
Mhm.
So I'm glad
Exactly.
about that. But
So one of the
yeah, this
things
is rare.
one of the things that we were talking about before the show, because you have somebody personally that you know, um, that had symptoms of this, that they misdiagnosed, and that's extremely common to have misdiagnosed everything, because remember, they're practicing medicine because they're practitioners. But one of the very most common things that they think is a contributing factor is migraines or other type of headaches like cluster headaches,
Yeah.
which are so common
Mhm.
in the population.
And then infections,
Mhm.
Epstein-Barr, the regular flu, chickenpox. There's so many
Seizures,
shingles,
stroke, mental health
typhoid,
conditions,
yeah,
medications,
scarlet fever,
recreational
fever.
drugs, brain tumors, degenerative brain
Exactly, so
disease.
much. And then I
I
think,
sound like
okay,
a commercial for
the
Pfizer.
commercial. Yes, the main ones, the two most common, Epstein-Barr in kids and headaches or migraines in
So,
adults, but
explain
that's the
what
two.
Epstein-Barr is for people who don't know what that
It's like
is.
forever mono. It's sucky. So most people get over mono pretty well, and we've all been exposed to it. If they run a test on you, you're gonna pop positive, probably. Very rare that people don't.
Mhm.
However, some people carry this at high levels, which I am one of those unfortunate people. I actually went through the gamma globulin therapy for this because I got so sick. And I will tell you, I've had radiation and other cancer stuff, and that was worse.
I was
That
just gonna
gamma,
say
oh
gamma
my,
globulin is awful. We used to
it was
have to give people that for, like, rabies, for playing
yes.
with raccoons or whatever,
Yep.
and they will
It's
tell
terrible.
you they have never had anything that hurt so bad.
It's like for months too.
Mhm.
And it was just he was very experimental on this and he told me that, but I do believe that that doctor cured me. But for those that don't get any crazy scientist doctor like I had, which I had to pay for out of my pocket because he cured himself and then he went off the rails trying to help people and then they didn't let him take insurance anymore. He got to still be a
Right.
doctor, but when you can't take insurance, yeah, gamma globulin without insurance is a thing, and it's, like, so much money.
I was
But
gonna say
ah,
very, very expensive, yeah.
and then I was on famciclovir for, like, 5 years after because of all of the treatment and everything, but I was getting everything crazy, like, I worked in the ER, so normal people probably don't have to worry about this, and I was just catching everything. I even caught parvo,
Mhm.
like, for a person. And I
We're
was
gonna
like,
have
this
to
is
put you down,
ridiculous.
lady.
Yeah, I know. I was like, what the hell is going on? So finally, this doctor did help me. And I'll tell you, like, this is probably one of these things that they could do that with, like maybe like experiment things more, but they're not going to do that. It's just
Right.
not a thing. But they did say maybe genetics play a part. And the interesting thing with my stepson, who does talk about his mental illness that he went through, and I didn't know anything about this disease before, but I started studying it and I was like, maybe God put this on my heart because this is weird because it fits his exactly what happened to him, which drugs is the other main. If you didn't get it from the diseases we talked about, the two main ones being Epstein-Barr, which is mono that stays with you at high levels. And so you feel sick for a long time,
Mhm.
or the cluster headaches for adults or migraines, actual migraines.
Mhm.
So it mostly, other than that, is brought on by drugs, which is why Singular has a black box warning for asthma, which I do take. And
Mhm.
it can make you feel weird at times. But this is the reason why, because it causes this, along with dextromethorphan or whatever in cough
Mhm.
syrup, topramate, and then LSD, mushrooms, any kind of hallucinogenic
Right.
type drug, which he had done because he was a silly kid. And he was doing mushrooms often to the point where it was like almost every weekend. And you can't
Mhm.
do that. And I'm not talking a little bit. We're
Right.
talking full on.
We're talking
And
a
so
busload.
yeah, we're talking a hero dose. We'll say that. Um, and he was having all these problems afterward, and he would come up to us and say weird things like, my hands are way too big. He actually got to the point where he would not look in a mirror. He was so body dysmorphic. And even now, he is really weird about the mirror. He actually constantly reminds me that mirrors were fallen angel magic and he hates them. And like it's
Mhm.
really been hard for him. But he would say his nose was way too big. His feet were, and he's a very handsome kid. And I would be like, what is happening with you? And his dad does have a really rare disease neurologically that is called so headache continua. It's like
Mhm.
forever.
Right.
Semicrania, something continua. Anyway, it's half of your brain is affected. It's normally women that get it, and they have a headache every day of their life, every minute of their life, unless they take Indocin, which is so strange because we don't use that anymore. It's like ibuprofen, basically. And he wasn't realizing he had these headaches all the time because he didn't know what living life without a headache was. And so on days where he was less than 3 pain, I think he just didn't think he had a headache. So he has this real genetic disease with headaches. And so I wonder if that predisposed his son for this issue where the migraines are a play on it. And he finally one day just went into, so at first, these symptoms are like auditory, or you'll see like wavy doors, or your hands will be big, or your nose are too small or too big, just like Alice in Wonderland. And that's why they think he had that, why they think Carol had that. But then they start going into derealization and depersonalization, which is what happened to our son. And he went into full-blown psychosis. And it was so bad. And we as parents did not know, like, first of all, the parents, because I'm the stepmom, were kind of in denial about this situation. And I was not, because I work in mental health.
Right.
And I was like, he has worn the same outfit for 30 days and counting. He won't look in a mirror. He's staring at a wall like it has a TV on it. And he's not talking or interacting anymore. Like he's not okay. And so finally he was getting to the point where he was getting suicidal. And I was like, if you guys don't do something, I will, because now I'm afraid. And so like, they didn't like that very much, but they understood. They finally got on board because he was getting scary. And that was hard because there had been a problem when he was younger that I got blamed for too. So I started getting freaked out, like they were going to blame me. And I was like, oh my gosh, I don't want to be in trouble again, but please help me help him, type of thing. So he went into,
I'm sure that was hard to like to observe as the outside parent, to see this going on, because parents, the actual parents, a lot of times it is very difficult for them to see or to cope with because they are so close to the situation.
Yep. Exactly.
So it's got to be terrifying to see those things like happen overnight and progress.
It was hard. And the weird one too, that caught me, and why I think he might have went through this, which I'm going to talk with him about, it distorts not only lines, but color. And he attributed this later because he says he's somewhat colorblind. And I'm like, and his Nana is colorblind, but I think, okay, well, that's weird. You weren't colorblind as a kid. And he went from being this fully functional, gregarious hockey captain of the team, like this just, phenomenally interactive human. Yes, he had his shy side too, but he was always very like go to what I described, sitting on a couch in the same sweater for 30 days. And no matter what we did or encouraged him, he got very schizophrenic, like where they won't shower and stuff. It was weird. And I was just recognizing it because I had been through this with patients.
Right.
But like you said, explaining this to people, they don't want to say like their child is defective. And I'm like, no, it's not like that. I'm not saying that he's defective. I'm just saying that he needs some help, and I'd gone through a lot with my daughter that had mental health issues. So I was like, listen, this just has to be taken care of. But I was also cognitive enough to know this kid is not going to work in inpatient psych. This is going to scare the shit out of him. And so we put him into a rehab program for marijuana because I live in Utah, which is hysterically funny, but it's the only thing he would have tested positive for. And so we had to choose something, and it's still a great program and you can still get help. And it was still lockdown and inpatient. So, you can have a secondary diagnosis of psychosis or whatever. So I was like, this is better. I feel like maybe there'll be kids his age, because he was super young. That was the only thing. If he had been older, I would have said, yeah, put him where he needs to go. But like at that age, you don't want to put a kid in inpatient psych. They might get hurt. And so too young, too young to be in there with the regular people, too old to be in with the adolescents. So if it had been an adolescent issue, I would have gone forward with that, but just it wasn't. He was too old. So we did that, and it actually he stayed there, and then after he got out of the program, it was months and months. He went into a sober living. He's still they like run the AA thing where he is now, and actually he met his girlfriend in there, and they have a baby now, and he's doing really good because he kind of came out of this.
Right.
But I was telling Janet, if it had been mental illness, he wouldn't be he just came out of it. It was weird. He like slowly, it was slow, very slowly he come out of things. And even still, little things still change. Like he'll start using nicknames now that he always used before for the kids, or you can just see the light coming back, even it's been a long time now. It's probably been 2.5 years.
Right.
And it took that long. And my husband said, so I was telling him about all this. I said, this sounds so much like what he went through, because it's just so similar. And he doesn't take any meds now. He doesn't have depression, like any of this stuff. And I think this might have been the thing. And he said, so they just let him not do anything until when they kill themselves, because these people get extremely suicidal.
Definitely.
Yeah, it really affected him.
Well, and you got to wonder too, if you're a person that's experiencing these kind of symptoms, and it's not just like, I mean, there's a whole host of them, which we'll go over in a minute. But if you are the person, or somebody that's experiencing these things, it has to be absolutely terrifying
Yeah.
to like look in the mirror and you feel like your hand is 4 sizes too big, or your feet are like an inch long, and instead of whatever the normal size is, or whatever. These changes in perception have to be frightening for the patient. So compounding that with a medical professional telling you that you're nuts, or you're imagining things, or you're going through a psychosis, there is a reason why these things happen. And like I said before, with the brain synapses, the cranial nerves, and medications or vaccinations that we give that cross that blood-brain barrier and make changes to the way that the electrical current processes, that's a problem.
And even now, even worse with the ones they made now, because they change your literal DNA.
Yes.
They're not even a vaccine. There's something worse. And they've ruled that in a court of law, by the way. That has come out. That is a true fact for people that have a hard time understanding this. But I will tell you, like, he had so much of this. And then on top of it, to be told, like you said, like you're just going through he to this day just says, well, I just went through psychosis because of hallucinogens. And I know that is probably what brought it on. But I do think there might have been a genetic component there. And he has residual effects. Like I said, the color is still like that. I'm going to ask him about the wavy doors and stuff, because he used to say that was really bad. But also, and shout out Baldovian Bears on Instagram or Spotify. My son now sings songs about what he went through. And he says, because I find this interesting, it says in here, feeling like you're split in two different people. He made that as the Bears, as the other part of him, which he didn't even know about any of this. Right. So he said, I just feel like I was two different people and I couldn't bring it together. And this was like the bear I had to face. And now everything he says in these songs, I'm like,
You're like, ding, ding, ding. That is checking all the boxes.
Yeah. Yeah. I think we diagnosed him, maybe.
Yeah,
I don't know.
Is like, the whole thing is so weird and trippy. That's why I said, like, looking into this, I was like, this is so weird, but so many people experience things like this. And it's most common in children. And it's less common in adults. But like these things, like self-perception, it's like changes in your perception of your own body, where we were talking about where things are too big, too small, or your whole body feels too big, too small, whatever. The derealization. So that is a form of disassociation where you feel you're disconnected from like everything around you. Depersonalization, which Heidi also mentioned, makes you feel disconnected from your own body. So a lot of times when people are talking about like feeling like they're overlooking their own self or whatever, the feeling of being split in two, where like your left and your right exist on their own, and they're like separate. You can see them both, but you can't connect the two, which I find that to be the most interesting part of all of this. Um, and a severe disruption in sense of time. So you don't have the ability to judge the passage of time, which since the derealization is kind of a form of disassociation, I have to wonder if the disruption in time isn't a little bit of like DID,
Right.
dissociative
It
identity
sounds that
disorder,
way.
because
I
they
think it
also
does.
have that where it's like, 2 years have passed or whatever, and they think it's literally only been 4 months.
Mhm.
Pe
Yep.
People get that with DID stuff, so that's why I was curious.
Mhm. That's weird.
So
Yeah, it's he definitely um is coming out now, and I'm seeing it. It's been really weird because like any other thing mental health wise that I've encountered, it doesn't fit the box.
no,
It doesn't fit, like, just all they do is just say, "Well, you just went into psychosis," and that's all. And I'm like,
just
"Yeah,
that
but
broad
people just don't
umbrella,
do that." Yeah, like,
right.
that's just weird.
Nothing
And
brought the
even
psychosis on,
right,
it
except
just
mushrooms.
happened.
But
Yeah,
the mushrooms would go away. I mean, I was like, "Okay, this was, like, almost 2 years
I
of
was
struggle."
gonna say mushrooms don't stay in your system that long,
No,
so for them to say that's definitely what,
it
ca
was. Yeah.
caused his psychosis, sorry, that's
Yeah.
crazy.
Silly. Yeah. It's
So, along with this, not just the self perception, but the visual perceptions that you have. So, changes in size. So, not just you, but objects. Kind of like it made me think of like the little message on your car mirror.
oh, yeah,
Objects in
yeah.
rear be closer than they appear. So, that's the
Yeah.
same kind of thing that happens. They can appear closer or farther away. They can be bigger or smaller. It changes in size and distance, where you literally think somebody's standing over your shoulder and they're literally like half a football field away from you.
Mhm.
So that's kind of creepy. Um, People appearing smaller than they are. So you actually perceive other people to be like munchkin size.
Yep.
So think about Willy Wonka.
Right. Yeah, that whole show. Yeah.
So could that also be,
It
a thing
kind of
because everybody inside the factory was
was
small?
short. Yeah. Makes you
Mhm.
wonder. Yeah.
Changes in object appearance. So, like you were talking about, squiggly lines, things are skewed or slanted. So there's nothing straight. Everything has a curvature or some kind of texture, zigzag pattern, something that's not
Mhm.
normal. Um, and so to me, when I think about like the curvy, wavy lines and stuff, it's kind of like looking at things like abstract art.
Right. Yeah.
You know what I mean? Where things are very like skewed and misplaced and whatever. So I can't imagine being a patient with this and looking in the mirror or looking at even like a bookshelf or something
Mhm.
and
I
how
know.
that translates
Yeah.
into their brain, what they see.
Knowing that it should be straight and not seeing it'd be like living in a Tim Burton film,
Mhm,
basically. And he also had light sensitivity, and I did just check, and that is one of the things that happens. And to this day, he wears sunglasses almost
mhm.
constantly.
Yeah, and
He that
that's really common for migraine patients a lot too, is the light sensitivity or smell sensitivity, because
Mhm.
even though it's like not talked about as much in this, you also have sensory changes in your taste and your smell.
Mhm.
That's why I
It's
thought
weird.
maybe it had something to do with like your cranial nerves,
Right.
because it affects so many different like senses and stuff.
Right. Right. It's a lot. It's a lot of synapses that it's affecting, like in here in general. It's funny to me that they miss it so often, because you would think if 30% of people go through this at some point in their life, you would think it would be more studied and known about. Like, I've never heard of this.
Well, and that's the thing, because when I was reading about this, it said that it was so hard to do research on this because symptoms in a patient generally either last for minutes or
Mhm.
hours, and then they disappear. So they're very fleeting symptoms for most people, unless there is a severe underlying cause,
Right.
hence drug toxicity or a lot of other things that can cause
Genetics.
misfiring
Yeah.
of your stuff. But they're like, oh, we can't study it because by the time we go to study it, like everybody's symptoms disappeared. So we
Right.
don't
But
know.
there's enough people that leave a residual. I mean, they say that from 1955 to 2016, there are fewer than 200 cases, period.
Probably
Diagnosed.
people don't
That's like
report it,
great. Yeah.
or doctors don't, well, because there's no actual confirmatory diagnostic
Mhm.
testing for this. Um, it's kinda like left up to the doctor's discretion when the patient's describing the symptoms, if the doctor's gonna go, or even if the doctor has ever even heard of this before, because we
Right.
had not.
No.
Um, so, it would be discretionary diagnosing at best.
But at least for the people that have the long term, like he did, I think they should be like, well, why does this kid still have this residual symptoms? You know what I mean?
Mhm,
Like he had it for a long enough period. And I'm curious, like I said, about the wavy thing, and I'll ask because the color thing stayed and the light sensitivity stayed. There's multiple things that have stayed. So he would have
mhm,
been a great one to do, and he had a ton of mental help. He had great insurance. He had all the things that you would think a doctor would say, you know what, maybe we ought to rule this out,
mhm,
with this particular person after 6 months of him being pretty much inpatient,
mhm.
it's kind of sad to me that during that time, they didn't run one test, not one EEG, not one CT,
Well, that's
not.
because they already put him under the label of psychosis. So
Mhm.
it's a catch-all umbrella, and they don't have to do additional testing and don't have to get to the root of what could possibly be causing psychosis. It could have
Yeah.
literally been a bacterial or fungal
Right.
or
Infection.
parasitical infection or metal toxicity or literally all kinds of things,
Mhm.
and they
They
don't
don't
check.
get into that. They just do
No.
a CBC, and if it's fine, then you're fine. But that's not gonna check fungal, that's not gonna check micro.
Mhm.
None of that is gonna be included, where he took something that did come from the ground, a mushroom of unknown origin. You would think, "Hey, maybe we should check for parasites. Hey, maybe we should check for, some weird random, like, the people that got that
Fungal
weird
spores.
the weird disease in the flower at the Salem witch trials, all that
Mhm.
stuff that made them crazy. So they say, and it was like a poison, it was a toxin in the flower.
Mhm.
And
Right.
so why not check for something like that? Especially as parents, we would have gave the go-to for all of it. We'd already met our full deductible with everything that had happened. We would have said, knock yourselves out.
Mm-hmm.
You know, we were at our cap anyway.
But that's
So,
the thing, though. I think number one, lack of education. They don't know about this, and number two, they don't know what the hell to run. They don't know
right.
what to look at, and a lot of times, they don't know how to interpret tests
Yeah.
and tell if there's something going on, if there's not something going on, because
They said the
But the
most helpful is the SPECT imaging for
Mhm,
MRI.
right,
But even that has to be accompanied with like,
with other
do they have
stuff.
Epstein bar or whatever going on? Do they have, some other problems? So they
Mhm,
have to meet criteria for sure. And I get that. But like also when you've got a kid that has no history of mental illness and all of a sudden this is happening, I think if I were the provider, I would have ran a bit more,
right,
knowing that it wasn't
especially,
true.
like, as rapid as it onset
Yeah,
and as sharply as it progressed.
it was bad. Yeah.
Those are things, like, as a provider, I'm sorry, but a nurse would have caught that, and a nurse would have
Mhm.
been like, "Hey,
So true.
I think
So true.
blah, blah, blah."
Well, and
So
especially to rule out like at minimum micro tests and parasites if
mhm,
it's from a mushroom.
mhm,
Who bad food happens. Like
mhm,
if you take it away that it was a drug and said he got poisoned from chicken or something, they
right,
probably would have done it, but they didn't do it because it's drugs. Well, it's also food,
right,
and that's a sketchy thing. So yeah, I think a lot of things are missed. In other countries, they routinely twice a year deworm everyone at the same time, and everyone knows it's just time. They just go to the drugstore and they just do it.
mhm.
And Americans are the only ones that don't do that, and that they just think, oh, well, we have the FDA. Okay. If you want to trust any three-letter agency with
Hmm,
your business, do that. But I'm telling you, tapeworms, ask Janet, in school kids, it's really common. And
mhm.
the other ones are even more common. What are they? The pinworms,
Pinworms,
little
yep,
pinworms. Yes.
mhm,
And so if they're common in children, then big people have them too. They're just used to it
mhm,
because kids are more sensitive and they itch and stuff. So,
mhm.
also fun
If
fact,
you're
if
an
you have
adult and your
reptiles,
butt
yeah,
itches all the time, you probably think it's hemorrhoids and
deworm
you're not
yourself.
thinking worms.
Yeah. Just if you have reptiles that have become widely, like my daughter had, oh, what the hell is it called? Some kind of dragon, lizard.
Komodo
Um,
dragon,
it's not that one. It's a little one.
iguanas,
Yeah,
yeah,
kind of like an iguana. I'll think of its name. But anyway, she had that thing and she has it still. And I just told her routinely, you need to deworm yourself every 6 months because they carry them. And it's a
mm,
it's a known fact that
mhm,
they have these pinworms. And, you don't want to be getting that or give that to your dogs or whatever.
mhm.
You don't want to do that. Bearded dragon. So
Bearded
just
dragon,
for
yeah,
people's FYI that they are widely popularized pet, turtles carry a lot
mhm.
of worms. There's so many things like that I've told my kids, nope, because they carry a lot of I don't want that in my house. Like,
No. Well,
and
you
she was
got
old.
you
Yeah.
got a lot of people to take care of in your household, so
Yeah. Yeah.
deworming the whole house would be not
Oh my
fun.
gosh. Well, we've done that whole trip with lice, and let me tell you, it was a
Super,
thing.
super
Oh my
duper
gosh.
time
Yeah, the kids get
consuming.
stuff at school. Yeah. I am still reminded to this day how I burned all the Barbies because I am a germ freak and I put the Barbies in the dryer and I forgot. I was only gonna do it for just a couple minutes. And I don't know what I was doing, but I went to do something. And that was the year my daughter got all new
And you're
Barbies.
like, "What's
I
that
melted them.
smell?"
I know. I melted their hair came out all like Frankenstein's wife, every single one. I felt so bad because some of them were like her sisters from when they were little. And I'm like, well, you're the one that brought home lice. I mean, it's not my fault. I'm freaked out. I don't want it. Yeah.
No.
But what do you do? Yeah. Kids
So,
happen.
something that, like, for me, as far as this goes, and like things to that can be responsible for causing either all or part of these symptoms, is neurotoxicity to drugs. And these
Mhm.
are the most common drugs that we prescribe. But there's one thing on this list that is super interesting that is literally in all kinds of shit we do right now. So the usual suspects, blood pressure medicine, heart medicine, cancer drugs, antibiotics, antifungals, antiparasitics, autoimmune drugs, seizure medications, anti-alcohol drugs, so like
Mm.
antabuse or whatever, HIV and AIDS medications, ooh, shocker, gout meds, vitamin
This is all
B6.
meds. This is all meds. What the heck?
But then there's other things on this list. So arsenic, obviously don't take arsenic. That's very
Don't
stupid. You'll
take
die from that.
arsenic.
Gold, but gold amalgamate is in fillings
Oh.
and all kinds of stuff. So think about like back in the day, like in my era or whatever, they did a lot of gold fillings
Mhm.
in
Yep.
teeth. So gold is bad, of course, illegal drugs. Glue, so don't sniff glue,
Mm.
bad idea. Nitrous oxide, which is laughing gas that they give
Oh,
you in the dentist office,
oh boy.
children. Ozempic,
That's a bad drug
hello,
in general. That's a
yes.
bad drug.
And here's the most interesting one on this list, hexane. So hexane derivatives are used commonly not only in glue products for shoes, for leather work, stuff like that, roofing. Also, hexane derivatives are used for cooking oils. So
Oh.
canola oil, and soy, any kind of soy products,
Hmm.
um, and cleaners, heavy detergents, things like that. All of these things are in vaccinations.
Oh boy.
And then it says products in which the technique is used, which is the making of the hexane derivatives, lacks any and all regulation by the FDA.
Oh wow.
Um, and this contaminant is a matter of high controversy, but of course the government doesn't care. But here's another thing that's really super interesting about this. Hexane is chiefly obtained by refining crude oil.
Wow.
What in the hell is our pharmaceutical system built on? Crude
Mm.
oil refining petroleum products.
Wow. So
So,
if you're glue sniffing, which is a real thing, and
true, huffing.
I would
Mhm.
imagine that the huffers probably are at real risk of this.
Yes, absolutely. So if
Yeah.
you think about it in terms of that, in terms of, people that do, sniffing glue or huffing paint or whatever, it changes the chemistry in your brain. It fries your synapses.
Mhm.
That is why, and especially reading about hexane being on this list,
Wow.
along with, vaccinations, medications, and all these other things, I thought, wow, from the very first day that you're born and you get jabbed with a hepatitis B, and
Right.
then you're commonly prescribed antibiotics, and your parents use corn oil, canola oil, soybean products, soybean paste, fluoride, petroleum products, etc., etc., etc. You are literally being poisoned from the get-go. And I was like, oh, well, no wonder there are so many people that have these symptoms.
Wow. And I just looked, and I think that hexane might be in surgical glue.
It is. And also hexane
Peroxides.
is used in hold on a minute. It is used in medical imaging contrast.
Oh,
So
wow.
anytime you get IV with contrast, hello hexane derivatives.
Wow.
Um, burn victims get it because it dissolves the gases, including oxygen from the air. So if you've had smoke inhalation, you go to the hospital to get treatment. You're going to get a hexane derivative.
Vaccine.
And partial liquid ventilation. So
Whoa.
ventilators that provide moisture air, also you're getting
Which is
hexane.
every single vent ever now.
100%,
Yeah.
100%.
We
And so, um, perfluorohexane is also a hexane derivative, which is called a PFAS. It's perfluoroalkyl substance, which this has been literally splattered all over the news lately. So PFAS, PUFAs, all that kind of stuff has been in the news lately because they're known to cause infection, immunosuppression, diminished vaccine efficacy, which we don't really care about that one,
right.
increased risk of infection, allergies, asthma, atopic dermatitis, and they are found most commonly in air, water, fish, and soil because they are contaminant pollutants from manufacturing of
Mm,
oil waste.
wow. That's crazy. So it's basically in everything. It's just like that one that's in everything. I can't remember the name of it, but it's another bad one that's in literally
Mhm.
everything.
Yeah, and
Um,
toilet paper and all that stuff.
yeah, yep.
Yeah,
So it's sounds like you can't get away from this,
right.
So that's
So
wild.
these are, I mean, I found that to be very, very interesting because all of those things with neurotoxicity damage your neuron pathways and your synapses in your brain, and also lead to cranial nerve neuropathy. So, you know, it makes it a dysfunction of your cranial nerves, which you'll have vision issues, smelling, hearing, taste, like all of your senses are going to be involved, which is why I said I think a lot of it has to be like uh temporary or long-term damage to your cranial nerves and your brain
Wow.
synapses.
Well, that's why they don't want to study it, because if
A
they
hundred
studied it,
percent.
yeah, and they found out, oh, by the way, this and this and that, then
Mhm.
that's 100% what they're doing.
Right.
Because I mean, all the things that we get here, and especially in America, and people want to say Americans are the fattest because they're lazy. I don't know too many lazy Americans, to be quite honest. Um, it seems like the heavy you are, actually, the less lazy you are. Not always, not when we get into gross morbidities, but I'm
Right.
talking about people that consume a lot of on the go things, a lot of, they're not taking care of things, whatever. It seems like that's the people that kind of get hit with all this stuff. And
Mhm.
I was once one of those people because I didn't have time, you know.
Mhm.
Um and it didn't really change for a long time, and then once it's in there, I don't know if you can get it out, you know?
Mhm. Well,
I
and
mean,
that's the thing is that if you have like uh damage to your synapses or to your cranial nerves or whatever, toxicity can get better as long as you detox from whatever is making you sick in the first place.
mhm,
So, if you're taking certain medications, stop taking those medications. Um,
if you can.
or yeah, or if you're like sniffing glue, stop it. You know what I'm
Yeah,
saying?
some things could definitely be helped, and like I tell people all the time, like, just because you know the guy that got you, I tell this to my kids. Just because you know the guy, Freddie, down the street where you got your weed last week or whatever, because I try to tell them after this happened with our one son,
Right.
even if it's all natural, okay, that doesn't mean he didn't get it from the cartel, the person that got it from
Right.
them, on and on. It usually always leads back to one place. And those people don't care about your safety and or if you're alive. So
100%.
yeah, you can't trust it unless you grew it yourself. Maybe if you grew it yourself, even then your soil could be contaminated. Even
Well,
then, yeah,
and I would not want anything from anybody unless I do it myself, unless I'm growing it myself,
yep,
because you don't know. I mean, somebody could be like a farmer down the street and something as simple as tomatoes or whatever, and you go to buy some, but they may be putting Roundup weed killer
yeah,
like
yeah. You don't
around
know.
the tomato area. So you're
Hmm.
literally taking in toxins and poison.
Yep,
So
yep. And there's certain foods, and funny enough, and this is probably why your diet worked so good, is because they say that vegetables hold more of these chemicals
true.
than
Yep,
meat because
100%.
they absorb the water and you're eating that, and that's not only holding minerals, but it's holding toxins. So you have,
Toxins. Mhm,
you have to be careful about where you're getting this stuff, like Janet's
mhm,
saying. Like if
mhm.
you're getting it, I don't know, with appeal and all this stuff that's coming out and the weird videos I've seen about watermelons
Yeah,
and
right.
all kinds of
Mm.
stuff, I don't know
The
what's real
fake
anymore.
the 3D printed, watermelons and
And
or whatever they are.
avocados, the rubber avocados that they go to try and make guacamole and smash them up and they're like bouncing around. And I don't know what's fake and what's not fake. Look, it
Right.
could be a scheme, but I'm telling you this, like obviously when they're mutating things to have no seeds, you're probably
Mhm.
messing stuff up. Like originally bananas
100%.
have big seeds in them. They're little
Mhm,
tiny bananas like this big, and they got big seeds in them. And they made that opposite. They made the banana big, but the seeds almost non-existent. And
mhm,
actually, all the nutrition for a banana is in the seeds, and they eat the seeds like in the
mhm.
jungle wherever they grow
It's
for
kinda
real.
like, eating papaya.
Yeah.
The healthiest part of papaya is the actual seeds.
Yep. And people
Mhm,
just want a better, easier, and I get it. They're annoying, like the watermelon, spinning seed, whatever. But I still buy seeded stuff now because
mhm.
I'm like, I just don't want to deal with, and we can't get away from it. It's not like I know Joey down the street, like, or who, however, I go to as many farmers things as I can during the season that they grow in, but
Right,
maybe just don't eat a lot of things out of season. That is
right,
what the people used to not do.
right,
Like they didn't have it all flown in from who knows where, manufactured, God knows how.
right.
Like, I'm
Well,
just
and
saying.
that's like a big part of our agriculture now and has been for a while now is the initiative and the push for bioengineered food. And so last year in January, they made it to where it's required if something is genetically modified to label it on the food source.
Mm,
But they're wanting to also do away with that and expand what they do with modification and germ theory and stuff like that as germination theory, not germ as
wow.
in like people,
Right.
but
Not bugs.
germination of seeds and stuff because my husband used to work for a company that owned a place that did that. They genetically modified seeds to make them grow faster or be resistant to Monsanto or whatever.
Others. Right.
So that was one of their big things that they did.
And find local things if you can, like meat,
Mhm,
especially, that's the little things we can all do because you don't know. You don't
mhm.
know where that comes from. I'm
W
sorry. Like,
And as far as meat goes, a lot of the companies, what they do, they will kill, the cattle or the pigs or whatever it is, and then they send them overseas to China for processing, and then they send it back to put on
you
our
don't know what you're
shelves.
getting back. Yeah. Who knows what
So
we're getting
you could
back?
literally be eating a chihuahua for all you know because you know what I'm
Yeah.
saying?
Yep.
Sorry to anybody that has a Chihuahua. That's the first dog that popped into my
They're
mind.
not much meat. We would probably pick a different.
Be enough for a toothpick.
Right. Yeah, that's a skewer. But I mean, we definitely have such a lax everything here is all shipped out all the
Yes.
time,
Mhm.
which is stupid because America can do a lot of things here.
And our medications, our generic medications are made overseas.
And most of the time it's in India, just so people know.
Uh-huh.
Yeah.
So
Very
you
little
don't
quality control.
really know what you're getting. You don't know what kind of contaminants are put under there because it's not under the I was going to say guise of regulations by the federal government, right? Not that
Right.
that's going to save you. But
Definitely
oh,
not.
let me tell you this one little ditty about the hexane stuff. I found this to be highly interesting and a wee tad sus. And so the U.S. National Institute for Occupational Safety and Health, okay, so NIOSH, set a recommended exposure level for the hexane and hexane derivatives and stuff. And it was overturned in 1992, and they actually raised the acceptable level of hexane, even though it is carcinogenic and neurotoxic to humans. They raised the current acceptable level in 1992.
Wow.
So you are getting actually 3 times more than what the previous level said was acceptable to human beings.
And why? If you go to other countries, I've been a lot of places. Food is different.
Right.
Food is
Very different.
different.
Yeah.
And it is weird. And that is why they're so weird about not letting you bring anything into California, like fruits
Mhm.
and vegetables and weird stuff. Like, there's reasons for all this, and people just go through the motion of like, okay, yeah, we got to have our car checked and we don't have grapes in here. And I always thought it was really strange, but then you study why, because they're trying to keep more organic stuff in
Mhm.
California. And same thing like from Mexico to California, back and forth, whatever. And I'm
Mhm.
like, but why is it okay everywhere else? Like, you can take it from Texas to Utah or wherever, like, that doesn't make any sense. And they really don't care. It's not like they shake you down. You just say yes or no.
Mhm.
Like,
Yeah,
okay.
they're not very rarely are they gonna search your car unless, they see a like
If you're a
a
fruit guy, you got fruit
exactly.
baskets everywhere, something crazy. But I'm just like, okay, that's weird. I mean, like, there should be little dings in our brain that say, that is weird. Why is that? Like,
Exactly. Mhm.
yeah. And how come all the other countries don't allow certain food colorings or certain dyes
Right.
or
Or
certain
certain
stuff?
foods, period, are illegal
Yeah.
and outlawed in other countries around the
Every
world.
other country but
One of the
here.
things is Twinkies, by the way,
Skittles.
for all the Twinkie eaters.
Yep. There's a
Gatorade.
bunch of them. Yep.
Mhm.
It's the food coloring in there and preservatives that they put, and actual taste enhancers are not
Mhm.
allowed in their cereals. They're in cereal, they're
Mhm.
in soda. And I will tell you, I'm a soda person. I like soda. And I've had them at other countries, colas, and it is so good. I was like, oh my gosh, it's probably good I don't live here because I would probably drink all the soda. But
Yeah, but
um,
it probably doesn't have all the garbage in it that ours
no.
does.
And you can taste a difference. It's really weird. It's like this weird, better. And then they don't have McDonald's on every corner in Italy.
Right.
Like, they have a little fruit stand bread thing on every corner. And my
Right.
daughter's allergic to gluten, but she could eat their bread.
Right, because it doesn't have vital wheat gluten in it.
And she could eat it. She was in seventh heaven, by the way.
Mhm.
When we,
I
same thing
would
for
I would
Paris.
love that because I mean, every once in a while I'll
So
crave
good.
dessert, but I would rather have bread, like really good bread.
It's good. It's
I
good,
like
baby.
America has the worst bread on the face of the planet because of all the garbage and crap we put in it.
Mhm. My neighbor, when I was a little girl, because Mormons are crazy. I'm just gonna tell you guys. But my neighbor lady, she was like crazy about all this stuff we're talking about. And I think she's smart. Now as a grown-up, I'm like, she was onto something. She wasn't so crazy,
Exactly. She's not really crazy.
Yeah. And she was into like Shackley vitamins, and she
Mhm.
was into like all natural stuff. And every morning she would get up. She had 6 kids, and at 4 in the morning she would get up and grind her own wheat. I'm not shitting you.
Mhm.
She would
I've
grind
done
her
that
own wheat
before.
and make all these loaves of bread for like the next day and a half. It would not last. It was bananas. But
Mhm.
I hate wheat bread, but not that wheat bread. That
Right.
wheat bread was good. Like that was good food. And she would make her own flour. She was super into all natural stuff. And now as an adult, I appreciate it. But her kids would come over to my house and be like, "You want some bread? Give me a Twinkie." You know, I'm like, "Yeah, you can
Mhm.
have a Twinkie." I'm like, "I'll switch. I'm sick of this." You know, like who cares? That's
Yeah,
cool.
I'll
But
definitely eat the bread that you make,
yeah,
not a problem. Mhm.
yeah, they're and actually their kids were like surprisingly healthy, which is funny until they started
Mhm.
getting in school age where and then they rebel, right? Then they got
Mhm.
quite a few of them got badly obese because
Mhm.
then they started eating school stuff and whatever. But
Right,
you
well,
can't control it
the
everywhere.
school food is a whole 'nother topic. That's a very
I
interesting.
think she packed it for them, but I think there was a lot of trading
I
going on.
was gonna say somebody is trading
Yeah.
their food
Somebody was being
100%.
naughty. And as teenagers, they all kind of went wild because that's the bad thing about Mormons. They put so much law down
Right.
that they're like, when they get free of all the rules, they go crazy.
Oppression, yeah.
And so it's a
That's
bad idea.
kinda like Catholic girls, not that I would personally know or
Yeah. Exactly.
I
The
don't have
Mormons
a
are
single story about that.
there we go. None of that. None of those Catholic schoolgirl stories, but the Mormon girls are right there with.
Mhm.
It's always the bishop's daughters that get pregnant. We're like, "Oh, yeah, you heard about Sally." You know? It was always funny to me because they would be high up in the church, like, and I'm like, "I know she went to that party last week because I heard about it," you
Exactly.
know? Yeah. I was always
That was
at home.
before video and stuff was available.
Oh, thank heavens for that, probably. Probably thank heavens for that. I was married
Amen.
early. I was good. I was boring. I was a boring kid. I was on the debate team. But I did like to fight and occasionally drink.
I
The
could
other
say that
stuff,
I side with
yeah,
that. Mhm, I
yeah.
could. Yeah. I had a little
Oh.
bit of a wild streak for, my childhood. My uh, older
Teenage years.
teenage years, I had a little bit of a wild streak, yeah.
Mine was mostly contained to those 2 things because the rest of it, I was like, I'll get murdered." So, but fighting, as long as I didn't start it, my grandpa was always like, "She didn't start it. I may have pushed it. I may have gotten their face and been a real dick, but I didn't throw the first punch." Yeah. I don't
Well,
do that anymore, for the
if
record.
if people come at you enough, though, you eventually have to do something about it. If you don't, it will never stop, so,
It never ceases. Yep.
yeah.
And my last fist fight was in my late 30s, but my son was telling someone that he said, "Yeah, my mom got in a fight. She had a black eye and a split lip and everything." And I was like, "Why are you telling people this?" And he goes, "Well, I was telling my new stepmom." And she goes, "A physical altercation?"
And he was like,
And
"No,
he's
an
like,
actual fist
"Yeah,
fight, you should have seen it."
yeah." He's like, "I mean, the lady pulled me in her car. She followed me home. I guess I cut her off. I don't really know. I didn't know. I cut her off. Apparently, I did. I bent down to say, 'Excuse me, why are you following me?' Because I got out. We pulled over. I got out. I didn't want to go to my house because I
Right.
saw she was following me. And she pulled me in her little tiny dumb car. She had like a lower car, and she grabbed me by the hair and pulled me in her car. And so her
Oh,
kid
that
was in there, but
mhm.
her kid was in there and she was like 2. And I didn't want to fight her because of that. I was like, listen, just go. What if I was crazy? What if I had a gun? Like, stop
Right.
this. This is wild. Like, you should go home now. You have a child in the car.
And
And she
you have
didn't like
road
that.
rage because you got cut off.
Yeah.
God,
It
now.
was so weird. And I was just like, I'm really sorry, but I had balloons in the back of my car for my daughter's birthday party. And like, I just didn't see you. And then I was like, but this is a bad idea with your kid. But she would not stop. And that's why I was all banged up, because I didn't fight back for a minute because I felt really bad. But eventually, like you said, it had to stop. I figured my neighbors would call 911, so I was trying to hold out, but that didn't happen fast enough. I finally did have to do something, and yes, I got free. But
You can only take so many punches before you.
yeah, I was starting
You
to
know
get
what I
banged
mean?
up. Like, but it was weird. That was a weird story. Like, I mean,
Well, see, and that's
and
not anything that's in your control, because
no,
somebody was just having a
bad day.
you can't control your emotions kind of day.
Yeah. I was like, this is crazy. I think that made her more mad because I said, this is crazy.
Are you
And she got more
crazy? I
mad.
think you're
Yeah, I was
crazy.
like, what is happening with you right here? This is not a good idea with children. But whatever. The cops didn't get mad at me. They finally did, yes, come. My neighbor was quite a busybody. He let me down that day. He took like 10 more minutes longer than I thought he would.
Well,
Otherwise, no fight.
he was not on the ball that day, was he?
I parked in front of his house for a reason. I knew. I was like, this guy will take care of this, because he will. So, long story short, don't follow people home and road rage them. That is weird. They could have a gun. Don't do that.
Exactly. That's a
Let it
very
go.
not smart idea in any way,
No,
shape, or form.
just let it go. Just be like, don't flip the bird, because they might have a gun. So,
Exactly.
I just shake my head. That's all. That's all it needs. Go on with your life. Yeah.
That's all we can do, right?
I used to be bad that way, but not anymore. You got to grow up at some point. But
That's true.
not that day. I was totally innocent that day. That was a weird day.
Yeah,
But
that was not your fault. That was
no,
a Karen's fault.
that was
Sorry to
weird.
any listeners named Karen.
Sorry, Karens. We don't mean you. The other one.
All the other Karens.
Yes. And so if you see these symptoms in your children or other people that you may love, you got to push, because the testing, like she said, is only like spinal tap. That's obviously to check for other things like mono. They're ruling out secondary diagnoses, or I guess it might be the primary, whatever way you want to say. A CT, MRI, spinal tap, EEG, visual evoked potentials. SPECT imaging was the best one. Strep, they do tests for strep as well, which is, I mean, smart. They're ruling out scarlet fever. They're just trying to do all the things with that,
Right.
but definitely important to know. So I guess if you're a parent, just push, be there, this is a really hard, like, you're just going to have to do sympathetic treatment, basically. You're going to just have to be there, supportive.
Yeah, and that's the thing about this, is that there's no like cure all for this. There's no like first line of defense or anything. It's basically treating your symptoms. So if you are a migraine patient, they'll treat your migraines and assume or hope that that takes care of the visual disturbances or the smell disturbances or time lapses or whatever. But
Yeah.
really, like we talked about earlier, they should be digging much deeper to find out, do you have neurotoxicity from a drug or from heavy metals?
From the hexane we put in everything.
Exactly. They should literally be doing heavy metal testing and stuff like that on people when there's
Well, and
something that's
especially
unexplained.
multi-diagnose. Yeah, when you've got this multi-problem,
Right.
basically. I mean, and I get it. Like, they're doing their best too, but like, also, Why don't they test for things anymore like that? You know,
Well,
like Lyme
because
disease, they don't even care. They just say, you have, too bad, we're not going to do the test for it. Like,
right. Well, because the tests are expensive and insurance companies don't want to have to pay for it. Like they used to test a lot of people for like West Nile and stuff when that
mhm.
came out. And now that's like not so much a thing anymore because the tests are expensive and insurance is like, mm-mm, we're not
Unless
paying
it's
for
like a
this.
bad, it has to get to that point, right?
Right.
Like, oh, maybe now he has, because you know, this guy I took care of, it was end of life and he has passed away. So I'm good to share. Um, it was end of life in his 40s because he went on a cruise and got mad cow disease. And it was
Right.
terrifying. That was terrifying to me. Literally, I was like, oh my gosh, this can happen? Like, what? And I was just shocked. I had, as a nurse, I was like, what the heck? But it literally killed him in his
Mm-hmm.
40s.
Yeah.
And there was nothing we could do about it. And then I didn't want to go in that room. I was like, oh my gosh, I don't want to go in the mad cow disease room. What? I was like, I'm not taking care of that patient. I'm agency. I don't have to. I don't work here for
Mm-hmm.
real. Screw that. Like when you're agency, you can be like, I'll go home. I told him, I was like, I'll go home. I'm not taking that home to my kids. That's crazy. And so, yeah, it was scary. But that can happen. Like they missed it. They missed it on him for
Mm-hmm.
I don't know how long. They just thought he had food poisoning.
Mm-hmm.
So, and then
Well,
he died.
food poisoning is very short-lived. And so if you
Mhm.
have symptoms of food poisoning that are lasting more than a day, something's wrong.
Right. Yep. At least max 48 hours.
Yeah. Desperately wrong.
Because
Desperately wrong.
yeah, you got a problem. And if you're popping a fever and all kinds of stuff, that's not food poisoning.
Right.
You now have something else going on.
Mhm.
So don't let people say that to you just because you might have, we call it at my house the J, because I don't know why, but it's diarrhea. My kids don't like
Sometimes
saying that word.
sometimes it may look like a J.
I guess so. They just started calling it that. And I'm like, you know what? I actually like that better anyways. I think they were embarrassed. And so they were like, yeah, J, because D is too many things, right? It could be a lot of things. So they were like, yeah, don't use that one. But it's the J at my house. So you're welcome to steal that for your children.
I'm going to tell that to Greg later. I'm going to be
Oh
like,
my gosh.
I have the J. And he'll be
Yeah.
like, what?
What?
Don't
My
ask.
daughter makes up funny things for everything. And she actually made up like fake names for our kids and like it sticks. And people always ask me, we call our smallest one Ruth. And it was because I brought her home and she said, I don't like that name. We named her Faith. And she said, I'm not calling her that. I don't like it. And she was like 14 and really sassy. This girl is really sassy. And I said, really? So what are you going to call her? She said, I'm going to call her Ruth every day of her life. I said, that's a terrible name. That's an old lady name. I said, she's a kid. She's a little kid. And my dad found out and he said, why would you do that? She had a beautiful name. Now she's got this weird nickname and people say, is this her middle name? No, it's just what we call her. I'm like, none of my kids go by their names. My daughter makes up new stuff for everyone. My husband is called Captain because
Well, you know,
she said, I already have a dad and a stepdad. So now you're the captain because you're the captain of this shit. Not ship. She said shit.
shit.
She's really fun.
You're the captain of the
Yeah.
J.
Yeah, apparently. And it stuck and everyone calls him captain. We all do it. I even do it sometimes. And it's kind of funny because it stuck so bad, but she'll do that. And my grandpa was a little nicknamer too, but she didn't know him that well because he died when she was little. And I swear to you, that went into that kid. I'm like, how are you so much? You didn't even like him when you were little, you know? But he was that way with everybody. He would nickname everyone. And so now she does it. She nicknames all the things. And I told her one time, why did you call her Ruth anyway? And she had really curly hair when she was little, my one that you just met. And it was like an afro. It really was big. It was some big, crazy hair. And she said, because she looks like one of the Golden Girls. And I said, She does. Yeah. Sometime I have a picture of her in a sweater, like a grandma knitted sweater. She said she looks just like a golden girl. And I said, I can't argue. Yeah. I don't know. She
Well,
did.
there with creativity. There you go.
Yeah. So if you get this, you're gonna be screwed. So don't get this. No one will help you. And you're
Well,
just gonna think you're
and
crazy.
that's the thing. If you or somebody you know has this,
Wow.
like Heidi said, be persistent. And do not accept psychosis as a diagnosis because
Yes.
it is not. There is
It's
there
a
is an
secondary diagnosis.
underlying
Yes.
cause that's making these things happen, and it's not
And you got to
normal.
find it. And
Yes.
you got to be persistent because my Ehlers-Danlos, I'll tell everybody, I didn't get diagnosed with that till 2 years ago. Had it my entire life.
Mhm.
And
And
now
she's old. No, I'm kidding.
oh yeah, I'm going to be 48 next month. I'm
You're
getting
still a
older.
youngster.
And I got 2 grandkids and 6 kids. So we'll see what happens. Depends on how much they procreate. I might have a huge family. But right now,
Everybody gets a nickname.
everybody gets a nickname. Yes, sir. And the dog and the baby are named the same name at my house. So that's funny. Not
Well,
my fault.
I was gonna say that would be
Dog
really
came
hard
first.
to
Yeah.
are you talking about the dog or the kid?
Yep. I just call him baby all the time because he's the baby. And so my dog also hates the baby. He's nice to him, but he's like, Mom, you're talking baby talk to another thing but me. That's not okay. So,
Exactly. A little bit of jealousy sprinkled in
oh,
there,
he's
here
naughty.
and there.
Yes. People always ask, why do you only have one dog? I'm like, oh, you haven't met my dog. He would probably run another dog right out of this house. He's not sharing
Mhm.
mom. Yeah.
Well, and that's how our cats are. They're very territorial over me, and they
Oh
don't like
boy.
to share me at all.
Nope. That's how my
Uh-uh.
dog is. If we kiss or hug, my dog barks at
Mhm.
everybody that I
Yes.
hug. There's
Mhm.
no touching Heidi. That's in a
Mhm.
funny little cartoon. I think it's Igor or something. It's a joke. We always say
That
that.
would be really funny on a t-shirt.
No touching Heidi. And the people that saw Igor, like Disney show, they'll be like, that's funny because it was. I think it was Disney, but regardless. So keep your eyes peeled, know what's going on, figure it out. And maybe by the time you're 50, you'll know you had that once when you were 12.
Exactly. That
Yeah.
is very true, especially in Heidi's case.
Yeah.
You know,
Or your
sometimes
stepmom will
it take
figure
a
it out.
minute.
Yeah. Your stepmom might figure it out when she's doing a random podcast with her good friend.
That's
Bestie
definitely true. So,
Janet.
where do you think they should start? Like if they have these symptoms,
Always.
what kind of doctor would you suggest for
If
them
you
to
go to the ER,
start with?
here's the thing. You have to be the advocate for yourself. When I
Mhm.
had an almost, and Janet knows, when you have a spinal infection, you
Mhm.
most of the time die.
Mhm.
If
Mhm.
I had, yeah, it's just a thing. When it crosses into your spinal cord, most of the time when I tell people I had that, they're like, oh my gosh. Like if they know anything medical, they're like, oh, I'm like, yeah, that was a pick line for 3 months, 24 hours a day, 7 days a week. So
Mhm. Fun
don't,
times.
I stayed there and I said, no, I'm not going home. And if I had gone home, I often wonder, would I be
If
dead?
you would still be here. Yep.
So you have the right to say no. You can
Mhm.
say it. I was not nice because I was like at a level 9 pain and I was not nice. And for those of you that say level 9, oh, sure. Because I have one of those people. I had a baby at home. I know what a 10
I was
is.
gonna say you're like me.
Yeah.
We have very high pain tolerances.
If I'm at a 9, we got a problem. Like this is serious. And so I
Mhm.
just told him, no, I'm not going home. And when she refused to admit me, I asked for a hospitalist. So first of all, if it is severe enough that you truly feel in any case, whether it's this or something else, that someone may die if you take them home, do not take them home. You have rights. You
Mhm.
have rights and you can say, no, I have the right to refuse discharge. I want to be admitted for further evaluation. They have to do it for at least 24 hours for your
Right.
safety.
Right.
So you have rights. You also have the right to go right back to another ER. You also have, follow up with doctors if they're available during those hours, depending on when this stuff happens, because seems like it's always in the middle of the night for me. But it would be bacterial first that I would rule out, viral second. I would definitely be on top of them doing testing. That is going to be rough for parents. Sometimes the pain is the cure. They're going to
Mhm.
do a spinal tap on your kid, and they're also going to cath your kid if they can't pee.
Mhm.
So it is what it is. A UTI is often our first thing we check for in mental health. Janet knows this too, because
Mhm.
that wreaks so much havoc, especially if you're over 60.
Right. It
It's
it
a
makes it makes patients almost have psychotic
psychotic. Yeah.
symptoms. Yeah.
Yeah. They get wild up. If you got a parent that all of a sudden one day seems like they have this, check their urine first. Because they
Exactly.
probably have a UTI. Yeah.
Mhm.
And it's really common. And even males, it happens with men, and they just don't think about it as much. I don't know
Mhm.
why, but it does. And they get overlooked a lot, especially if they're uncut. So just
Mhm.
FYI on that. Not that that's a bad thing. I don't necessarily agree with that either. I'm just saying it just happens.
Right. It's more
So
common because of
yeah.
the dark,
Mhm. Dark
moist.
area. Yes. The coverings. So, and when you're young, you're able to fight off all those fun things. But as you get
Mhm.
older, it becomes a little rougher. So, also make sure, if they've had a recent chicken pox, if it's possibly gone into more,
Mhm.
definitely tell them. Like when you're giving a history to a doctor, you might think, well, he doesn't need to know
Tell
they
them
had chicken pox.
everything.
Yeah, everything.
Everything. Yep.
Yep. And don't just say, okay. Say, are you sure about that? Shouldn't we run? But I would not leave anywhere without a CBC
Mhm.
minimum,
Right.
because that's going to tell your white blood cell count. Actually, I probably would request at least a 7, a Chem 7, and a CBC, BMP, um, and rule out a stroke, because that's another
Mhm.
thing that this could mimic. I mean,
Right.
that's terrifying.
Right.
So these things, like my husband with his hemicrania continuum, there's like hardly anyone with this disease. And I
Right.
actually knew what it was before we went in. And he's like, your wife's kind of nifty to keep around. He's like, you should keep her around. She's kind of smart. And I'm like, oh, well, he's been dealing with this for like a decade. And I knew something was wrong. I was like,
Right.
and he's like, mostly women get this. I would have not looked for that had you not mentioned it. And I was like, well, I think this is what he has. And sure enough, if he takes that Indocin, he's cured. It's like he
Mhm.
said, you'll know it's a miracle cure. If it works, it works. If it doesn't, it's not going to be a little bit. And
Mhm.
so, and he gets very rare migraines anymore. So he
Well,
went
that's
from
a good
having,
thing.
yeah, 2 to 5 times a week to like maybe once a month, which
That's
is,
that is
yeah,
better than
changed
99%
his life.
of
Yeah.
people who are on migraine meds.
Yep. He changed his whole life, and they tried to put him on those migraine preventatives first. And I said no,
They don't
because
work. Mm-mm.
I don't like the side effects either. So
No.
I said,
Mm-mm.
I'm not willing. He's not willing. We did try Topramate. We did try
Mhm.
that one, but he also lifts weights, and Janet knows my husband. And they told him, well, you might lose weight. And he was like, nope, we're not taking that.
Mhm.
I was like, give that to me. I need that. But no, I don't want it.
Give me a
And
double
so
dose.
I got my problems. I got my own stuff. I don't need any more medicines in my body. I got enough
No.
problems.
Mm-mm.
So, but I would do that. I would definitely continue. If it continues, say you have all this checked and you go home and this continues like it did for my son. This was months. This wasn't days that
Mhm.
he sat on a couch staring at a wall in the same clothes. You've got to do something. You
Mhm.
you cannot just let them go. I would never have let my daughter go that long. I was dealing with a lot of people issues, trying to coordinate this as like, let's do
Mhm.
this as a coordinated effort versus let's bring in the police and get
Right.
crazy. and I didn't want to go there. Would I go there? Yes.
Mhm.
Yes. If it would save someone, absolutely, I will be the dickhead. Yeah. So
I think I would wanna, like, visit a neurologist
mhm,
because I would want them to look at my brain function
mhm.
and cranial nerves before
Yes.
anything
If
else.
none of that other stuff happened,
Mhm,
worked, like bacterial, fungal, whatever's
mhm.
going, I would say neurology. Yep.
Yep,
Because most
absolutely.
insurances now don't even require
A
that you
referral.
go to,
Mhm,
yeah, and so just you can just do that. It's amazing. They don't tell you that, but you can do
mhm.
that by yourself.
Right.
Unless you're, I think Medicare. I think Medicare still is weird, but
Mhm.
and possibly Medicaid, I don't know. I
Or
know my mom has
TRICARE.
problems.
If you're part
Yeah,
of the military, you can't just go wherever you want
can't
unless
just
you
do
have
what
a
you want.
special type of
All right.
plan.
And then if it's still going on and on, I wouldn't just accept, like Janet said, like what we did. Oh, he's just got psychosis. And even when I accepted it, I still was like, that doesn't come out of the Cheerio box. Like what the hell happened?
Oh,
And
wait,
they just,
that's today's prize.
yeah,
You
there
get
you
some
go.
psychosis.
Yeah, psychosis with your Cheerios. And I was like, wait. And then I was the overbearing, over involved stepmother.
Mhm.
So then I shut up. But if you don't have that problem,
But you also probably saved him from taking his own life.
yeah, I think we all did finally because it
Mhm.
just was terrifying. And, to see him regenerate in front of us has been like
A
amazing.
blessing. Yep.
So much. And he's telling his story. Again, check out Baldovian Bears, Balduvian. I know it's huge. Like I said, it's his split personality thing, not that it's real, but like how he felt at that time.
Mhm.
And he tells it in his lyrics. When you hear those lyrics or see the lyrics, it's very much like it's very Depeche Mode or like The Cure. It's like that music. So
That's all
if
right.
you don't, yeah,
That would be
yeah,
up my alley. Mhm.
yeah, you would probably love it actually. And he's great, but if you don't love it, at least look at the lyrics and see what he went through because it was dark.
Mhm.
And I'm going to have him on. He already said he would. He said he would come on and talk about addiction and cure and psychosis and
Mhm.
the dangers of just trusting mushrooms from your buddy and stuff like that. So,
Mhm.
yep,
Well, you
you got to be careful.
definitely need to talk to him about this because it's
Yeah.
fascinating.
It's
Absolutely
crazy that
fascinating.
we accidentally found it. That
Yeah.
we I
Well,
just pulled it.
and
Yeah.
it's funny because you sent this, and while I was looking into this, something else came up, and I'm like, "Ooh, now I have to go research that because I don't know what it is."
Oh, what did
So,
Janet find?
good pasture syndrome.
Ooh. Again,
So
Troubles Garcia, look it up.
exactly. So
Good pastures.
that's gonna have to be like our next thing to see what
We
that
gotta
is.
make up a name for our little offshoots of medical podcasts, like medical mayhem or something crazy. I don't
Right.
know.
And it's always we're always doing something weird, but
Yeah.
I kind
Yeah.
of like that
I
because
do too.
being in
Yeah.
nursing for such a long time, you can get really bored and in a rut of
Yes.
stuff. So
Yes.
this is fascinating to me. And
Agree.
like the stuff I do with trebles is fascinating to me because I get to look up new stuff and look at
Right.
things in a different way. So
Yeah, I like it too. I think it's super fun.
yeah.
So, yeah, I'm with you 100% on that. And I think that it keeps our minds active.
Hmm.
Also helps us not just be in conspiracy world all the time or like
Right.
religion for me. Like I'm either in Mormon world, conspiracy world. So this is a nice something else,
I'm just in
And
my own little world.
yeah, yeah. She's over there in her world, but it cooled down today for her because she
Oh,
finally got some air conditioning in her world.
praise praise Jesus. I
Praise
have
Jesus.
not
Yeah,
had air for 2 weeks.
that is
So,
good thing to have.
thank God, because I was
Oh,
baking internally,
oh,
since it
for
was
sure.
like 110,
Ugh,
115 degrees here with humidity. So,
that's
yeah,
bananas. Yeah.
I'm
Nope.
blessed. that it's
Yes.
back on, and I'm still blessed that I still have a roof over my head and all that
Yes.
stuff. But
Yes.
making meals and whatever was interesting
Oh,
because
Lordy.
wasn't about to go out in the heat and cook
Cold soup day. It's
and
cold soup day.
couldn't use the
Blender soup.
oven.
Yeah.
Exactly.
That's a real thing, people.
You
There's
can
some
eat
great cold
blueberries.
soups. Yeah. There's great cold soups. I've made them before, or cold
Mhm,
pastas. Because I'm
mhm,
not, yeah, I literally have been saying that all week. We're in a heat wave and we're very near to like Vegas and southern Utah. It's 114 in southern
mhm.
Utah today. That
Yeah.
is, I used to live there. No way. That's why I don't live there no more. I'll deal with the snow. I'll take that snow any day of the week over 114 degrees where the asphalt's dripping. No way.
Well, I was gonna say, it's funny that you mentioned that because our driveway has like the tar patches and the
Oh
cracks
my
and stuff,
gosh.
and they were
It's
melted
melting.
last week, and it was actually taking like tire impressions every time Greg would
Ugh.
drive over it,
It's
and
time
then
for you guys to go to
it would
Canada.
it would right, it would pull him up out of the cracks, and there would be like these
Oh.
plates with his tires from
Oh my
from
gosh.
the melted
You're
tar.
like, "Hey, your tire marks are in the other corner. We need to move them
Exactly.
so they can melt back into the crack
I have
properly."
never ever
Oh
seen
my
that in my
gosh.
life, and I'm like, "Oh, well, that's a sign that, it's too hot."
Ugh. Last year when it was like this, it's my birthday in August, and my husband and I always do something because it's our anniversary on my birthday.
Mhm.
And so we do something fun. And he said, "What do you want to do?" I said, "I want to get the hell out of here." And he said, "Where do you want to go?" I said, "Anywhere north." And he said, "Okay." And he was so confused. And I was like, "Listen, I just hate the hot." So I looked up a whole road trip and we went to Banff and it was fantastic. I highly 10 out of 10 recommend going to Canada right now. Just go see Davy Wavy. Go to Canada. It's way
Hi,
too hot.
Davy.
Hi,
Yeah,
Davy.
Banff,
Oh,
the castle thing.
it's actually it's an outdoors park in Canada. And
Mhm.
it's
Greg
kind of
went
like
there.
their Yellowstone, like a
Yeah.
Yellowstone. It is um breathtaking. And I live in the mountains, so like I'm not easily impressed because Utah is pretty impressive. Okay. Like there's some mountains here that are pretty fantastic. No, the
He
Banff
went
is
there for work,
whoo,
and then there was some kinda, like,
mm,
castle or something there too,
so
and so,
beautiful.
like, he was sending me, like, literally all kinds of pictures and
Uh,
stuff.
it's
I never
great.
travel, I never go anywhere, but he's, like, been all over the
See, you
world.
gotta do it. I just hate doing the airplanes. That's what I told him. My
Yeah,
two
I don't.
conditions were we gotta drive because of my back,
Mhm.
and I'm not getting in the airplane on the damn seat for 8 hours. Like I'm not rich enough to fly the way I would love to fly. That's
Mhm.
crazy.
Same. I'm not
So,
a fan
yeah.
of flying anyway.
Oh,
I would
let me
much
tell
rather
you.
drive myself, so
Yeah. Or a train. I was looking into like the Starlight Express and stuff that they have,
Mhm.
and that's cool, but that's really expensive.
We were looking into that to
I have a
go
pearl clutch. Yeah.
to, like, go to New Orleans or stuff,
Oh,
which
yeah.
is not supposed to be terribly far from us, but
Mhm.
it's supposed to take, like, some stupid
30
amount,
hours.
like
Mhm.
13 hours or something by train when it's, like, a 6-hour drive,
You're
and
like,
I'm like,
"Eh, I don't think
nah,
so." Yeah, I'll
thanks.
drive myself.
I
Yeah.
like our little day trips.
Yeah.
That's basically what we do.
Well, we wanna go to New Orleans, so I'm gonna tell my husband, we gotta go and meet Janet and
Yeah,
Greg in New
we'll
Orleans.
coordinate that trip. I can get
Yeah,
him to
that
ride
would be
that far in
fun.
a car,
Oh,
yeah,
see?
yeah.
Woohoo. My husband will be like, "We're doing what?" He's always like when I said it about
You
Canada, he
huh?
was really sketchy with me. He's like, "I've never even heard of this place, blah, blah, blah." And I'm like, "No, it's fantastic." And he had the best time. He doesn't ever stop talking about it. He goes on Google Earth. We've been to
Mhm,
Rome. We've been to all over. He still talks about Banff. He loves Banff. So, and the
mhm.
people in Canada are so nice.
Depends on what part of Canada you go to.
Yeah, depending. Yeah. Well, most of the people we met were so nice, but they didn't know
Mhm.
who Rush was. And my husband's a crazy Rush fan, just so everybody knows in Canada. And it was,
Tell him
it
not to
was,
mention that to Greg because Greg
oh
hates
boy.
Rush.
Oh, he loves Rush. And so he was telling these young kids, it was funny because we stayed at all these resorts and stuff. And I said, they aren't going to know who that is. And sure enough, they did not. And he was shocked to he had a pearl clutching moment. I was like, okay, I don't know. But the funny thing is it was right as my podcast launched because I'm like, oh, today's my birthday for my podcast. I'm going to have a birthday for it soon. But today is the day.
Happy birthday, podcast.
Thank you. Thank you. Oh, not a better way to have it with my bestie. This is good. I looked at the date. I'm like, oh, yay.
There you go.
So birthday day, and we went and I was telling people about the podcast. And funny enough, I still have a pretty high following in Canada.
Well, there you go. Hey, that's a good thing, right?
Yeah, it's so funny. Canada and England, funny enough.
Well, there you go. I have
and Australia.
I have those two, and then I have some very off the wall places I've never heard of before. And I'm like, where's that?
You're like, what? I have the 1%ers that are like all the way down in all the other countries, but the bigger percentages are the 3. And I think that the Australia makes sense because I do the show with Drew and he's from Australia. And so I've been on like 3 or 4 Australian shows, which is fun. You know, they say things I don't understand. They said no wuckas. And I said, what's a wucka? I didn't know. It means no worries.
Yeah. And see, I love that because every once in a while, like I'll watch TV shows that are British or Australian or whatever, and their words are very different. And I'm like,
so weird.
What?
And want to get an England person, like really turn flat red. Then the word, I'm sorry, English people, I'm going to say it. The word fanny, and there's people named Fanny in America.
Right.
Is really derogatory female part word.
Right.
And like the P word here.
Well, and that's what they say. If they like somebody a lot, they get fanny flutters.
Well, those are, flutters. So it cracked me up. And I finally had an English guy on and I said, I'm going to ask you something. And he goes, uh-oh. And I said it and he has red hair and he turned as red as his hair. I thought he was going to stop the podcast.
I love that though, because the wording that they use is so very different. And stuff.
When I told him there was people named that here, he almost fell off his chair. Shout out Tommy Colon.
Your real name is vagina.
Yep, exactly. And the derogatory name for it, by the way. And I'm like, well, even in America, it does mean booty, like cute little booty or something. But people use it all the time. And he's like, oh, no. I'm like, I don't know. That's how it is. So no fanny, no wuckas.
If you go visit over there, don't say that
word. They get really, he didn't get upset. He just was clearly not okay. So it was pretty funny. But yes. So that's it for us today. We're being silly, but anyways, we can be.
Well, thank you so much, my love, for coming back. Tell everybody where they can find you.
You bet. I am Heidi Love. I'm at the Unfiltered Rise podcast. I'm everywhere podcasts are served. I do have a Patreon. It's $5 a month. You get multiple extra shows a month because I don't ever want to cut my episodes. I'm really trying not to ever do that. It's weird for me because I do this because I want you to have the information, not cut it. And so that way you can get the Blood Atonement series, all about murders, Mormons, and mayhem. And we talk all about the naughtiness of the Mormons, and including I also do monthly Mormon Monday with Paranoid American. I don't know how I ended up in so many shows, but I love it. It's fun. We do that as well for that, and you'll get that early. Also, I started a website. It is the unfilteredrisepodcast.com, and it's very minimal. But if you need a link to the podcast, like say you don't have Spotify downloaded or something, it is on there. So it can redirect you through that. Eventually, it will do a lot more cool things, but that's what it is right now. I guess I got to talk to Catalyst.
I know. That is not my forte, anything tech.
No.
Somebody else can do that.
It's a struggle. Janet, will you tell them, in case they're seeing this on my show, where they can find you?
Absolutely. You can find Deplorable Nation on every podcast platform, or you can find it on Rumble, on my Rumble channel. And you can get a hold of me on Instagram at Deplorable Janet, or on Twitter at NoJanet, KNOW. That's
There
it.
you go. That's us.
So we love you. Thanks for tuning in to another episode. And Heidi will be back with us again.
Bet. Yes, medical mayhem is what we're up to. Somehow.
Absolutely. So have a good one. Have a blessed one.
Bye.
And we'll see you next time, guys.